Hi everybody. How many of you brought home gold and silver yesterday? It was the Akshaya Tritiya, wasn't it? So how many of you celebrated the National Ocean Day, the National Public Garden Day, no, the Child Care Provider Day? Yesterday was also the World Lupus Day. Lupus? Systemic lupus erythematosus? What? That is what expressions we get when we start talking to our patients about the disease that they have. Okay, so let me take it a little slow. Have you ever felt any one day that you felt feverish, lethargic, don't want to get out of bed, just missed that day in school or college? Have you ever felt a rash which you thought was disturbing your looks and you don't want it and you wish it away? Have you ever felt an ache in your knees? Have you felt alarmed when you comb your hair and see that there are those few strands of hair which you are losing? Well, lupus is that and much more. Lupus starts in young females. It starts with symptoms which can be as insidious as the ones that I have told you. And it produces many sick days on your calendar. It affects your mobility, it affects your looks, and it sort of scares you. This is lupus. For the last 25 years, we have been writing the stories of these lupus patients in our lupus registry files. Let me tell you the story of one such female, right from these archives. She was 17 years old when she came to us in the wards. She was admitted with tuberculosis of the brain. She also had a rash. She also had joint pains. She also had protein in her urine, and we found on testing that she had lupus. This made us really nervous because we needed to give her medicines called corticosteroids to bring her lupus down quickly, and this would definitely worsen the tuberculosis in her brain and we could lose her to the complications of tuberculosis. We had a very tight rope walk to do, and we did that. We walked on a knife's edge. She went home happily. She studied. She got a software engineer's job. She married a guy who knew about lupus and understood it. Then she landed in another problem, an increase in her disease activity, which we call the flare of systemic lupus erythematosus. And during this flare, she had involvement of her kidney. So we gave her a medicine which would be very good for her kidney, but which would affect her ovaries and probably decrease the chances of her having a child. Anyway, she improved. A year later, she had a complication. The head of her hip bone crumbled. She needed a surgery to strengthen it again, the total hip replacement. She said, "I'm not feeling good. I have a brain fog. I can't concentrate on my job." Anyway, we also saw that one of her blood counts were very low. These were the platelets, which were so low that she could at any moment land into a dangerous bleeding. So we gave her steroids. We now gave her a very expensive drug, and she improved again. In this game of snakes and ladders, we are always strategizing to see whether we are on top of the dangers. And I've called my talk today the snakes, ladders, and butterflies. I have told you a little bit about the snakes. Let me make the snakes a little more clearer. In quite a few of my technical talks, I talk about lupus as a multi-headed monster, because any one of the following symptoms can be the beginning of lupus. A rash on your face, on your arms, fluid around your lungs, fluid around your heart, swelling in your feet, frothy urine, just aching joints all over, and everybody saying, oh, it's fine, oh, you'll be fine. Any one of this could be lupus. So the disease itself is the biggest snake. And then there is the snake of uncertainty. I'm a control freak, and uncertainty is a spoiler in my life. But let's look at diseases which we all know very well. Let's look at diabetes. You have diabetes, you have your blood sugar values, you take them to yourself or to your doctor, adjust your medicines, and you're doing good. Let's look at hypertension. You have your blood pressure values, you target them, you bring them to control, and you're doing good. But what about lupus? Lupus is uncertain. Should you let go of your ambition to study abroad, to leave your city, to leave your village, to leave your family, or the safety net of your doctors who have now known your lupus, and go abroad and settle somewhere and study? Should you tell your fiancé that you have lupus? Should you spend a few years knowing your disease, how it will behave, before you decide, okay, now it's time, my disease is good, let me start my family? Once you're carrying a child, knowing that there is a genetic risk to this disease, but no way that the doctors or any geneticist can tell you how much the risk your child carries, then you will live in dread. Will you live in dread for 1 year, 10 years, 15 years, to see whether your daughter is ever going to get the disease? Or she may never develop it at all. The third very important snake in this game of snakes and ladders is knowing too little. Since any one of the symptoms can be lupus, and since lupus is not known, this ignorance can be at the level of your first point of contact. It may be an ASHA worker, it may be a primary health center, it may be a district hospital, and this knowing too little can spread very far. So in the 1990s, Professor Malviya from AIIMS Delhi went into the rural areas, surveyed the population, and said that out of 1 lakh people, 3 had lupus. Using this estimate, we can place that today our population will have around 50,000 patients with lupus. In 2018, 30 years later, Professor Amita Agarwal from SGPGI Lucknow started the INSPIRE cohort. 9 teaching university hospitals from across the country contributed to patients with lupus, and 2,504 patients of lupus, the first one who entered the cohort in 2018, have been followed for the last 6 years. And in these 6 years, we have lost 200 patients. They have died. Can I have the next? This is a snapshot of places, the district of Telangana and the places around Hyderabad. The numbers refer to the number of patients referred into this INSPIRE registry, to which NIMS has contributed 16% of the patients, around 400 patients. If you look at this, then 67 marks Hyderabad. And if you see, most of the patients come from around Hyderabad. Zoom out and you will see that the further you go away from Hyderabad, the number of patients being referred to NIMS falls to single digits. These are the 9 centers which have enrolled patients of lupus in the cohort. Look at this perspective and you'll see it's very easy to imagine that there are a lot of places in India which are not even documenting the lupus that they see, and there are large parts of India where lupus is not even being recognized. This is knowing too little and knowing too much. In this cohort of 2,504 people, we have lost 6 to suicides. And these are young people who know that they have a chronic incurable illness which they will never be free of. And we have countless stories of people being sick at home and not coming back to hospital because they do not want to burden their families further with the expense associated with lupus, hospitalization, and its medicines. So do we have any ladders? Yes. The first and the most important ladder is the health system. So at in the public health system, at one end, you have the ASHA workers. These ASHA workers cater to 1,000 patients, or 1,000 actually healthy people in the rural areas and 2,000 people in the urban areas. They are supposed to track the health of every community member, report them to the healthcare system, and they are also supposed to see that when they are given a regime to follow for any disease that they have, that they take the medicines timely and they complete the regime. These ASHA workers have delivered the hugely successful polio eradication program of the country. If we are able to ignite the minds of these 1 lakh ASHA workers which we have today, then we will make their minds know what their eyes cannot see. And that is where I think the fight against lupus goes. In tertiary care hospitals like ours, where the brunt of the lupus care is now being provided, both at AIIMS, NIMS, we have been trying to build up capacity over the last 4 decades. Starting from one training unit in Madras, we are now 15 centers across the country where 60 students enter into a 3-year DM clinical immunology or rheumatology program. And they do this after finishing a 3-year course in either MD medicine or MD pediatrics. And when they enter this course, the most difficult disease to learn, treat, and understand is lupus. The other very strong rung is modern medicine. In the 1950s, only 50% of lupus patients would live beyond 5 years. Today, 90% of lupus patients continue to live well after more than a decade. What do we do with this information? We have to strengthen this. In the 1960s, we got hydroxychloroquine. In the 1960s, we used cyclophosphamide to improve the outcomes of patients with lupus nephritis. Then came mycophenolate mofetil. Then came rituximab. And now we have the CAR T cells. And so medicine is strengthening itself to continuously expand the life expectancy of patients with lupus. So what else can we do? It is our dream to reach out to every patient of lupus, reach out to them early, and then hold their hands for the next 30 to 40 years. And how do we do that? We need to make our health system so robust that even if it does not know lupus, it knows that there is a deviation from health significant enough to report it to the health system early. We have to treat each patient with time, medicines, understanding, and support. We have to use individual resources to fill the gaps which exist and which will not go away very soon. We have to learn to talk about lupus like we talk about diabetes, like we talk about hypertension, so that there is no dread to it, and like we talk about HIV and AIDS, so that lupus patients can come forward and live the life as long as they want with the disease and not be burdened by it. So let me come to the butterflies. This is a ChatGPT generated image which shows you the butterfly rash spreading from one cheek over the nose to the other. We don't have a vernacular name for lupus. I have fought that battle for a long time. Can I make a Hindi, Telugu, Bengali version of the word lupus? No. Let's just accept lupus as it is. Lupus by any name is just as dear. So let's accept lupus completely and let's spread the word. Thank you.